Now, the book follows a case study format, as you mentioned earlier, but why not just a list of symptoms and differential diagnoses? What does the case study format offer that would not?
Good question. And I suppose that's one of the differences between the current book and this book, is that it's all based around cases. And the reason for cases is it's to try to contextualize facts and figures and knowledge into something more real life, something that presents in a pharmacy. So it's matching what you know with the patient in front of you and trying to ask the right question at the right time for the right reason. And that's the difference really between the case study approach and a normal textbook, which is lots of facts and figures, allowing people to contextualize their thinking in a given context. So how you think about a problem, say cough, will be very different if it's a 5-year-old child or a 75-year-old elderly patient.
You've mentioned clinical reasoning several times. Can we just explore this in a bit more detail? I mean, is it just common sense, or is there something a bit more academic?
I think it's a bit of both. It's grounded in theory, but there is quite a lot of common sense that you employ. It's about bringing forward to the conscious level your thinking. So it's about testing a hypothesis. It's about thinking, well, if I've got a 5-year-old child with a cough, what's the likely diagnosis? And then testing that hypothesis by asking those questions which are pertinent at that time in the conversation. And the type of question will change depending on the context. And it will depend on the response of the patient as to what question you would then ask next. And that's the key difference, I think, between traditional ways of pharmacy, eliciting information using those 2-1 type approaches, and clinical reasoning. Clinical reasoning is very flexible. It responds to what the patient says, and you as the clinician are directed to ask your next question based on the information that's been provided by the patient. So each clinician might do it slightly differently, but we will start at the same point, i.e. a patient comes into the pharmacy with a particular problem, and hopefully we'll all end at the same point, i.e. we think we know what it is and we can help them. But getting from point A to point B might be different depending on who you are, your experiences, and the way in which you ask the questions and the way in which you process that information from the patient in real time. So that's why I go back to that, asking the right question at the right time for the right reason. That's fundamentally clinical reasoning. It's how do you process the information that you get, and how does that shape your thinking in relation to what you think might be the problem with the patient. Therefore, that will dictate your next line of questioning.
So does this mean, looking again at the 5-year-old and the 75-year-old man, a question like how many cigarettes do you smoke a day, which might be routine for an adult patient, would not be appropriate for a 5-year-old?
Yeah, fundamentally, that's your common sense part.
Yeah.
Okay. So we know that there's lots of conditions which cause cough. What we're trying to do is use the tools, the knowledge, to our benefit. So we know that a 75-year-old elderly patient is not going to have croup because that's something that little children get. Likewise, we know that a little child is not going to have COPD because that's something you get in later life and generally because you've smoked. So that initial consultation point where the person presents allows you to take that long list of conditions and narrow it down into a smaller number of possible conditions which you then can test as to what is it likely to be. So you might have 20 conditions which cause cough, but straight away by the person that you're talking to and the context that they present in, i.e. how long they've had it or things like that, you can go down from, say, 20 conditions to 2 or 3 or 4 quite quickly, but then you're very targeted in the questions that you ask.